Good morning everyone. This is Dr. Rekha. My topic of discussion is avoidable blindness. So blindness in WHO definition includes inability to count fingers in daylight at a distance of 3 meters to indicate vision loss less than 3 by 60 or its equivalent. By NPCB definition, presenting distance visual acuity of less by 6 by 60 or central visual fields less than 20 degree in the better eye. So this is the Snellen's chart modification denoting in 6 meters chart. So types of blindness includes economic blindness, social blindness, manifest blindness, absolute blindness, curable blindness, preventive blindness and avoidable blindness. So avoidable blindness include the term preventable blindness and curable blindness. In preventable blindness, the vision loss can be prevented by attacking the causative factor at an appropriate time. Say for example, corneal blindness due to vitamin A deficiency and trachoma can be prevented by timely measures. Curable blindness can be restored by timely intervention. Say for example, cataract blindness can be treated by surgery. So the categories of visual impairment includes low vision and blindness. So under low vision, less than 6 by 18 to 6 by 60. Economic blindness includes less than 6 by 60 to 3 by 60. So the category 3 to 5 includes social blindness, which is less than 3 by 60 to 1 by 60. Manifest blindness includes less than 1 by 60 to perception of light, and absolute blindness includes no perception of light. So coming to the prevalence of blindness, according to 2001 to 2002 survey, it is 1.1 percentage. 2006 to 2007 blindness survey includes 1 percentage of prevalence, whereas WHO goal reduces the prevalence of avoidable blindness to 0.3 percentage by 2020. The National Health Program targets to reduce the prevalence of blindness by 0.25 percentage in the year 2025. So these are the causes of blindness. For example, cataract, refractive errors, glaucoma, posterior segment disorder, surgical complications, PCO, corneal blindness and other causes. So the NPCB, that is National Program for Control of Blindness, which was launched in 1976. Later, the Trachoma Control Program, which was launched in 1963, was merged under this NPCB program. It is a 100% centrally sponsored program. So the objectives of the program include to reduce the backlog of blindness through identification and treatment of blind at the basement level, to develop comprehensive eye care facilities at each level, say for example PHCs, CHCs, district hospitals, medical colleges and regional institutes of ophthalmology. So to improve quality of service delivery, to secure participation of voluntary organizations to improve eye care services and to enhance community awareness on eye care. So these are the NHM components of NPCB. Say for example, they conduct free cataract surgery at district hospitals, conduct eye screening and distribute free spectacles to school children and elderly, collect donated eyes through network of eye banks and send to the eye donation centers, diagnose and treat various eye diseases like glaucoma, childhood blindness and squint, etc. They procure and maintain ophthalmic equipments at sub-district hospitals, training of paramedical ophthalmic assistants posted at PHC, and strengthens the eye banks, IEC, that is information education community activities on promoting eye health. So we should know about Vision 2020, which is the right to sight. So this draft plan of action was submitted to the Ministry of Health and Family Welfare in the year 2002. This has some strategies to follow, like it strengthens advocacy and generates public awareness proposed at national, state and district level. So it mainly concentrates on reducing disease burden on major diseases and human resource development and eye care infrastructure development. So this is the various goal strategies formed under NPCB action. Like they have Center of Excellence 20, training centers targeted to be 200 based on the tertiary care they provide, service centers 2000, so based on the cataract surgery, facilities for refraction and referral services, and vision centers targeted to be 20,000. This is mainly concentrated on refraction, prescription of glasses, primary eye care, school eye screening and referral services. So the target diseases which come under Vision 2020 includes cataract, childhood blindness, refractive errors, low vision, corneal blindness, diabetic retinopathy, glaucoma and trachoma. So basically we have to orient the patients with the initial assessment, evaluation and methods of prevention in terms of primary eye care, secondary eye care, tertiary eye care and specific programs involved in the National Health Care Program and long-term measures to prevent blindness. So primary eye care includes treatment and prevention of common eye conditions which include conjunctivitis, xerophthalmia, ophthalmia, neonatarum, etc. Provision of essential drugs like topical tetracycline, vitamin A capsules, eye shields, pad and bandages, etc. Trained the persons to refer difficult cases to eye centers, for example, penetrating foreign bodies, painful eye disorders, corneal ulcers, etc. Promotion of personal hygiene, sanitation, good diet for the people. Secondary eye care includes definitive management of common blinding conditions, for example, trichiasis, entropy and cataract, glaucoma and ocular trauma, PHCs and district hospitals level strengthening, eye camp organization and mobile clinic setup. Tertiary care includes at national or regional capitals associated with medical colleges and institutions. It includes sophisticated eye care for referral facilities, etc. and eye banks, the establishment and education of blind in special schools and utilization of their services for their employment. So it also has provision of super specialty and referral eye care services which include diabetic retinopathy, glaucoma, childhood blindness, retinopathy of prematurity, keratoplasty, etc. at regional institutes of ophthalmology and medical colleges. Construction of modular eye operation theatres at Regional Institute of Ophthalmology centers for providing modern and tertiary level eye care services. So the training of eye surgeons in basic level to various specialties of ophthalmology for improving their skill development. So to conduct services like blindness and visual impairment survey, trachoma survey through identified institutions and relevant camps. They also conduct school eye health service and screening programs to establish various refraction services and low vision training centers to facilitate the vision recovery. So the functions of eye bank, which include promotion of eye donation centers, collection of the donated eyes from the deceased persons to the relevant areas. So the distribution of the donor tissues to the corneal surgeons in various hospitals, research activities for improvement of the preservation methodology, various corneal storage methods, etc. So finally, for the rehabilitation of the blind, we have to concentrate on following things. So medically, we have to rehabilitate them, training and psychosocial rehabilitation, educational rehabilitation by providing various employment activities, vocational rehabilitation by involving them in various awareness areas, etc. So one of the basic human rights we have to know is the right to see. So all the avenues, the hospitals, even district health centers and tertiary centers are always aimed to restore the best possible vision to all the curable blinds. Thank you.